Sleep Tech Talk is sponsored by React Health. React Health, headquartered in Sarasota, Florida, is a sleep and respiratory device manufacturer. By manufacturing our comprehensive range of products spanning from sleep to ventilation and oxygen solutions, we have curated our portfolio to offer unwavering support to physicians and DMEs across the continuum of patient care. Within our LunaPAP device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our LunaPAP device line while accommodating diverse patient requirements. Adding value for our patients and partners, our ventilatory solutions seamlessly support a patient's journey from the hospital to home. Rounding out our robust respiratory portfolio is our spectrum of oxygen support, including both stationary and portable oxygen concentrators, along with a selection of essential accessories.
A brief message from our sponsor, Medbridge Healthcare. For job opportunities with Medbridge Healthcare, please visit medbridgehealthcare.com/careers. Once again, that's medbridgehealthcare.com/careers. Now on to the show.
Welcome everyone once again to another episode, but this is just not another episode. This is a very special episode of Sleep Tech Talk, your sleep podcast with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Mannikarote. We're coming to you on the special episode for this special week. It is Sleep Tech Appreciation Week, and we're just so excited once again to do this for all of you sleep techs out there. And do us a favor, hit the like button, hit subscribe, hit the star rating, put it in your comments, all those things that help this get promoted to other people. And most importantly, do not forget to share it with your friends all across the world. It is Sleep Tech Appreciation Week, and we have something special, which is, I don't know how special you're going to take it, but it's us three talking about some of the things that we learned over the course of the almost 2 years now we have been doing this podcast. And I think it's something that's very significant for all of us here as sleep technologists, and that is the question of sleep navigation in the hospitals. To kick off the discussion, Robert, you have presented this on multiple occasions now across the United States, and I know that you and I are going to be meeting up in a conference pretty soon where you're going to be talking about it again. So to kick us off, could you just tell us a little bit about what you think about sleep navigation and admission readmission reductions?
There you go. Absolutely. Thank you, Jerry. So, and happy Sleep Tech Appreciation Week to all the listeners out there. We appreciate you very much for being regular listeners to the podcast and for what you do for patients who have issues with sleep apnea. We appreciate it very much. And that's what this show is all about. I know that, we certainly are the face of Sleep Tech Talk, but the sleep techs who listen to the program and the sleep professionals who listen to the program are really the heart of the program, and we appreciate it very much. Inpatient sleep apnea screening. I'm surprised that I presented this at several different conferences recently, and even did a national webinar for Into Data talking about inpatient screening. I'm surprised that every hospital doesn't have a sleep apnea screening program already. Except that it's a very difficult it's a very difficult thing to implement. There are conflicting priorities a lot of times for hospitals that may prevent them from rolling out a sleep apnea screening program. My approach to and really the idea behind my presentation and the way that I sort of sell sleep apnea screening in the conferences that I've been to recently is all about risk management while the patient's, it's identification while the patient's in the hospital. There's a risk management approach to it so that you're protecting the patient while they're in the hospital. It's coordinated care. It's coordinated post-discharge sleep apnea care. In fact, there's a thread on the ASM's Engage website right now where people are talking about their inpatient programs, and I guess their approach is a little bit different because they're actually talking about inpatient sleep testing. And I think one of the things that we know is that there is a reimbursement for a sleep test that's performed while the patient's in the hospital. So that's a little bit of a difficult. Why not identify the patient, protect them, but then really put them into the pathway once they're discharged. Because, one of the things I think we have to take into account is that patient is in the hospital, maybe even post COPD exacerbation, and really they're in a recovery phase. So all we want to do is to, hey, identify the patient, know that they're a high risk in the high risk population, have that plan of care for the patient that we, sort of ensure that they're going to follow through with once they're discharged from the hospital. And even in some cases, part of the program that I actually I'm communicating right now is that there's even a pathway for some patients to leave the hospital, especially if they're super high risk, and perhaps they don't have the ability to pay for a CPAP device, or maybe they're uninsured. That patient leaves the hospital with a CPAP unit so that they are protected on night number 1 after being discharged from the hospital. So there is a pathway to get there. Again, it's not easy, but it absolutely, number one, every program that I've ever been involved with, and I know some of the other companies out there that talk about this, they typically see about 25% of the patients who are within the 4 walls of the hospital will be undiagnosed for sleep apnea and untreated. And that's the patient population that will keep our sleep labs busy for the rest of our existence in sleep medicine. So, I think that's why it's important for us. And I know that the other problem, and I talk about it during my presentation, is that many sleep labs are backlogged. So it would just be exacerbating the problem. And I have to, sort of address that with, we have to triage patients, when they are referred to the sleep center. If it's a non-complicated patient that you're essentially looking for sleep apnea, do a home sleep test on that patient. Don't fill up your in-lab beds with non-acute patients when there is an easier path to diagnosis for the patient. And then, again, having that long-term plan of care. When we talked to the sleep navigators from Wellstar, one of the questions that I had asked was, do you follow and track your patients' adherence post-discharge? And they're just overwhelmed with the number of patients that they're educating and navigating while they're in the hospital. So they just don't have the resources to be able to do that. But imagine a program, and on my slide deck, I literally use a lifeguard, and the sleep tech or the sleep coach is the lifeguard for the patient at post-discharge, with the idea that, through remote patient monitoring and adherence monitoring of that patient, they're able to, at times, mitigate a readmission and bring that patient into a physician practice for an office visit, instead of coming back to the hospital. I don't want to keep talking without letting you guys ask a question or get a word in. So sorry.
No problem. I know you're passionate about it. I've seen you present this, so I know how passionate you are. But I do have a question for Emerson. What are your thoughts on this based on what Robert just said?
Well, it's a subject I've been chasing since 2009. And I remember the very first time I heard of the concept, Sharon Bear at Respironics was talking about a study that she did with Rami Kayat and at Ohio State. And in that, we began to see, here's this opportunity to screen patients. And they were the very first that I know of that did anything like that. They even used the old Stardust, and they were doing home sleep apnea tests in the hospital. And it wasn't a sustainable model, and that wasn't the purpose of the study, but it began a dialogue that we began to have across the country of, what if you could impact cost? What if you could impact cost of care and all of the things that matter to hospitals? And that's exactly how sleep navigation has just continued to grow. Is, the CCSH in and of itself is a sleep educator credential. And it's been so fun to watch the different leaders, individuals who've now become leaders, take that credential and make it great, in sleep navigation. But I think the thing that Robert points out, and Massey Arrington and others, is, what is that real financial impact? And, because we can't think of it in some altruistic fashion that if we do good patient care, good things will come. There's truth to that, but we've got to be able to own the metrics. We've got to be able to define what is that cost impact, not only in the cost to do it, because it's a loss leader in many cases, but what is that cost impact down the road? And I think that sleep navigation, the sleep coach, the CCSH, it is the future of sleep technology, because technology is just going to get better and better. We're still going to need people taking care of people. That's never going to change. But we need more people interacting with patients, having that conversation. And that's what sleep navigation does, is it really allows us to to have a better penetration of the market, of the care institutions that we interact with, and grow the sleep business in a healthy way. And I think that's exactly what this does. And it's really our future. And we've got to own it. And if our listeners are not stepping into that space, then it's a shame on you. You should own this. It's the best opportunity for your career and for the people around you, for your market, for your employer, and even your friends and family that you care about that need good sleep health.
You know what I think it
So
does
that's-
too. You know what I think it does too, Emerson, is it changes the position of where sleep apnea lands today. You know, today it's an outpatient, you know, procedure, an outpatient service that sometimes is the forgotten service in some healthcare facilities. This puts it square in the middle of chronic care management of patients who are sick, and we know that it exacerbates their current medical condition if it's severe enough.
Absolutely. But think about this, before we started recording today, one of the things we were talking about for our listeners was women in sleep. And so you've got one end of the spectrum, which is chronic care, comorbid, where sleep apnea is a confounding factor. But then you go to the other end of the spectrum and you've got women in sleep who have UARS, they're undiagnosed, untreated, and they're at this other end of the spectrum. And instead of getting some type of sleep disorder breathing therapy, they're pushed to a medication. They're pushed to a stimulant to make them feel better. Maybe it's Provigil, maybe they do need it. And maybe this sleep study did show that, but how many don't even make it that far to determine what it is? So the navigator role doesn't have to be limited to the chronic care patient. It can be brought back to educating women who are being marginalized and pushed to the side because they're told well, you're a mom, you're busy, you should be tired. And that's not true. If you slept 7 to 8 hours and you're still tired, something's wrong. And we
Yes.
have to be able to do more to help that part of our population.
Hold up. Folks, we've got some exciting news for you right now, right here on Sleep Tech Talk. Want to let you know that we are looking for 2023's Person of the Year. That's right, Sleep Tech Talk's 2023 Person of the Year. How are we going to do that? Well, listen up. Any guest that's been on the show so far, and any guest that's going to be on our show for this year, 2023, are all nominees or all candidates for this recognition. And how you can help is by listening and or viewing that specific episode. We're going to be counting the number of plays for each episode. We're going to be counting the number of listens for each episode and taking that into consideration. If you have anybody that you think should be a candidate, let us know. And we will see what we can do to get them on board as a nominee. At the same time, we need your help to make this happen, to select that person of the year. Along the way, we hope to introduce some other awards as well. But in the meanwhile, do everybody a favor, do us a favor, and listen in to your favorite guest. So by early next year, 2024, we'll be announcing the winners. Now back to the show.
So, Robert, a question for you. First off, Emerson, when you said Stardust, I was like, oh gosh, that's a very, very long time ago. But
It's a
Robert,
workhorse.
Imagine a home sleep test that you can't administer without a screwdriver.
Exactly.
Those were the good old days. But Robert, so Emerson was talking about this, that, hey, if you are not on board and if you're not doing this, you're doing disservice to yourself. What steps do you think, if a sleep technologist wants to get into this and wants to develop a sleep navigator program, what are some of the basic steps to get started into this?
That's awesome. So in my slide presentation, I actually use the term, how do you eat an elephant? One bite at a time. And that's the way you have to start these sleep apnea screening program. I always try to start with small screening efforts, meaning, maybe you pick a wing or a particular patient population that you can administer a proactive sleep apnea screening program for that group, which, by the way, should never include surgical patients. I know that there are there have been, articles and things posted and about pre-surgical screening for sleep apnea. I know that there's certainly a need there, but I promise you, you will be very disappointed in the results that come from that of patients that actually follow through with the actual sleep testing and the sleep care that's needed. So certainly want to start with the patients while they're inside the four walls of the hospital. Pick a small patient population, do it for a short period of time, and just show the prevalence for that group during that small period of time. So that then now you've got a story to tell that you can go to administration to show that there is this absolute need. Now can we expand the screening program and maybe you add another patient population and do that for another period of time. Whatever the steps are that you sort of have to get the buy-in, it all has to start with that mandatory. And that's the other part of it. I know that some hospitals I've talked to and worked with in the past, they have a sleep apnea screening program that's part of their EMR, but it's not mandatory. So, everyone just skips over it and moves on to the next screen on their, in their patient management. So it needs to be mandatory. And then there needs to be an action that's associated with a patient that scores over a certain level. And I typically try to talk about that too, because for us, we know that for a stop bank survey, 3 or more positive responses would typically mean a patient is potentially a candidate for having obstructive sleep apnea. Most hospitals use 5 or more because 3, using that benchmark of 3, produces more patients than a sleep navigator can even come in contact with on a daily basis. So 3 to 5, typically you provide a sleep apnea education and make sure they understand that there's a pathway to get treated post-discharge. But 5 or more, there needs to be intervention for those patients and protect them while they're in the hospital with a plan of care post-discharge. I can talk
Emerson,
about it all day.
yeah, I can tell, but
I don't know
Emerson,
what you're talking about.
pinging off of what he said, I was remembering when I had a similar conversation with one of my customers many, many years ago, Stardust days, and their comment to me was, Jerry, this is really hard. This is really hard to do. How would you respond to a technologist or somebody who has a sleep lab or whatever? How would you respond to them that has that kind of a bit of feedback?
It's anything that's worth doing can be difficult. When we look at what we do in sleep medicine and sleep technology, we've got such a great future in front of us. And I think that there's this mentality of, that technology is going to replace us, that that things are going to change. And it's so funny. I remember when we went from paper to digital, everyone thought the sky was falling. And then we went from doing 2 nights with a patient to 1 night with a patient, and the sky was falling. And the funny part about that is that there's this one statistic that hasn't changed since I got into sleep. 90% are undiagnosed and untreated. It's still the same number that it was when I started in sleep in 1998. And so when we think about what's difficult about sleep and what's hard, it's as hard as you make it. I love the art and science of sleep medicine. I think it makes it fascinating. We did the CCSH conference last week in Chicago, and it was so fascinating to listen to the dialogue with the students in the class and hear what different people are doing. And I think, if you're wanting to make a difference in the world around you, you don't have to look far. Yeah, you may be in an institution that isn't championing what you want to champion. Then change institutions. There's so many other people out there looking for techs that want to work, that want to participate. I mean, go to Indeed. There's over 1,000 open positions across the country, probably closer to 2,000. And what that tells us is there's opportunity for us to grow and own the opportunities that are in front of us. Because that's, if you listen to the consistent theme of Sleep Tech Talk, it's about innovators who saw an opportunity and made a difference. It doesn't matter if it's Una talking about her app and her program, or if it's our WellStar friends with Massey and his team. They saw opportunities, they made a difference, and they began to own it and drive it forward. And now they look like overnight successes. They certainly weren't. There was a lot of work, a lot of time, a lot of failure, and then finally success that led to this. And I think when we look at sleep, We've got to look at it that way. There's so many good things in front of us right now. I mean, before the call, we were talking about the new meds that are coming to treat sleep apnea. I mean, those are going to happen. Are they going to be the cure-all? Likely not, but they're going to frighten people and think that, oh gosh, here's this thing that's going to take my job away. People take care of people. And I'm going to continue to say that as the leader of the AST, is that we take care of people. And that's what our role is as sleep techs. And we've got to do that. We've got to step up to a higher level. And that's what, the sleep navigator, the sleep coach, the CCSH, that's what that's about, is owning that patient journey and representing what's best. Because the other side of it is, when we look at the failure with CPAP, a little bit of that's on us, because so many patients end up being non-compliant after the DME stops checking them. The attrition is unbelievable. I mean, it ends up, I think, ultimately about 30% stay on therapy. So how are we owning that journey? It's kind of like what you were talking about, Robert, with the sleep navigators from Wellstar. What happens after that patient's on therapy? Well, most of them are going to end up off therapy. What can we do as sleep technologists to step in the gap, bring that patient to oral appliance therapy or something else to help them succeed, so that they don't end up with the comorbid conditions that the sleep heart health study says we're probably going to end up with. So that's a bit of a rant, but that's where when I hear the word hard or the term hard, all I can think is there's so many good things to tackle as a sleep technologist in your market, and the world's our oyster.
I was just about to say, can I get an amen based on your rant? But
Nice.
Robert, what I was going to ask you is, how would you respond to that? Hey, this is really hard to do.
Well, I'm not sure that there's anything in our industry that's easy anymore. I used to tell people that sleep was fun back when it paid, several $1,000s per procedure, and even when we ran paper, it was there was some fun aspects to some of that. But no, I think it's all hard now. And I think one of the things, if I can implore anyone who's listening to this program and their sleep center, is to get involved in the process of care for the patient after they've been tested. Don't let the test be the end of your engagement with those patients. I have had some engagement with some different national diagnostic, sleep testing companies recently, where, trying to find out, what involvement, what post testing engagement do you have? Do you have a newsletter that goes out to your patients to educate them on other things related to sleep, sleep disorders that don't necessarily have anything to do with sleep apnea? So, and especially for a hospital-based sleep center, I remember years ago when I worked at Respironics with you guys, I met with a medical director one time, and I said, you have spent millions of dollars. You have some of the best sleep techs. Your facilities are phenomenal. What's your CPAP adherence? And, he was up for the challenge for a second, and then he slumped back in his chair and he said, I have no idea what our overall CPAP adherence is. And I said, isn't that a problem? Because, you can't just do the test and then leave patients to, be relegated to the DME provider and a follow-up appointment every once in a while. Let the sleep centers become part of it. In fact, I've tried to advocate for some sleep centers, to have a login to AirView and Kerr Orchestrator and iCode Connect, so that which patients are non-adherent to CPAP therapy. Maybe as a sleep clinic, you intervene and do bi-level rescue on some of those patients. Maybe they need another titration, to come back into the lab. Maybe it's even that patient needs Inspire surgery. If I'm the manager of a sleep lab at a hospital system, I'm taking credit for every Inspire procedure that takes place in the OR, because I want them to know that it all started with my department, in order for them to get the revenue that came from that surgery.
Emerson, so what he just said right now, I found very interesting. Would you also agree that if when it comes to challenging yourself as a sleep technologist, this post-sleep or post-test care would be a great way to get your feet wet to start looking at some work outside of the sleep lab?
Absolutely, because the reality is this: most patients are going to go to CPAP first, mostly because of payers. So that's an unavoidable reality. And there's nothing wrong with that, because if CPAP works and the patient's adherent, fantastic. High five to everyone. But the problem is that so many patients end up non-adherent. And so is it COMISA? That's their struggle. So are we working with people like Una and behavioral health to talk about what are the solutions to manage that insomnia? Maybe it's simply not tolerance, and do they need Inspire or one of the other stimulators for the airway? Is it oral appliance therapy? I mean, how do we help that patient succeed? Because everybody gets aggravated about the SAVE study, how horrible it was. But if you really think about that for a minute, we could have made a difference. The sleep technologists are the most passionate characters in this whole story. And I believe that with my whole heart. I mean, we're the ones, and I've said this at conferences, we're the ones that if we're at a dinner party, we're thinking about what mask size somebody's going to wear, their size of their neck. We're the ones that don't mind having that conversation on a flight across the country about sleep. We're the nerds of sleep technology or sleep medicine.
I see that sore on your nose, sir. Can you tell me what's type of you're using?
Exactly. Yeah, that had to be a profile light. But I think what it is at the end of the day is the sleep technologist. There's this gap that we can fill, and that gap is helping patients succeed in their patient journey. Because here's the thing: if a patient came in to see their doctor because they couldn't sleep well, they're wanting to solve that problem. It's like the theory of the person that walks into the car dealership, they're supposed to walk out with a car. Well, the person came to the doctor to solve a problem. And if they walk away with it unresolved, we failed. I mean, the only thing in life where 30% is great is baseball. That's a batting 300 is 30%. It's fantastic. But everything else in life, it's failure. And that's where we are with CPAP adherence in long term. We're not at 50%. That's only in the first year. After we look at that at 4 years, that number plummets. So I think to answer you is we have to own that journey. Number one, for the patient. Number two, for ourselves. And number three, for this industry. Because patients deserve to have great care. They deserve to get answers to their problems. And nobody is as passionate about succeeding at that as the sleep technologist. And we have an opportunity there to step into a place that we love, that we can own, that nobody else owns right now. And I think it's just ripe with opportunity.
So
yeah, an opportunity. I actually think that's an opportunity for the ASM, maybe even to, as they and the ACHC, as they, make changes and update their policies related to accreditation. Maybe that post-discharge care. I know that you have to have patient records that are available to, the surveyors when they come. But maybe some of the standards need to be around, what is the success rate of your patient population post-testing in the sleep center? Because if let's say that the patient is put on a CPAP device and is non-adherent to the CPAP therapy, if the sleep center were truly tracking that patient, and I know you could say, well, maybe that's the sleep physician's job to do that, but as a sleep center, I think that we have to get involved in that part of it. So maybe it's, if the DME doesn't have a relationship with a dentist, that the next step is that the sleep center is intervening for that non-adherent patient to introduce them to an oral appliance therapy solution, or perhaps Inspire surgery is the right pathway for that patient, but really not leave the patient at the footstep of diagnosis and follow through with, now we're opening up the doorway and here's the treatment options for you as a patient, and we're going to stay with you until you find the room that's right for you.
Well, think about our last episode I think it's episode 61 with Dr. Mezrahan is that very opportunity. So you've got RPM as a part of that solution. Are you participating with a physician that does that, and being able to step in and help monitor those patients and coach those patients on those metrics is fantastic. So, I mean, we keep saying it over and over. There's plenty of opportunity. It's just finding the right partners, finding the right place to step in and fill that gap.
So we are out of time, but I want to extend this conversation because I am the timekeeper and it is Sleep Tech Appreciation Week. So the question I have for you, both of you guys and folks out there, as you can see, we're a little passionate about this. So I have to ask this question. What direction do you see the industry going with the changes that have already taken place, plus some of these things that you both have proposed on what we could do as sleep technologists and what the larger organizations could do in order to help direct and shape that? Where do you see the direction of the industry going?
You go first, Emerson.
Oh boy. I think that I think it's going in a lot of directions. Certainly AI is going to change much of what we do. And to think that it isn't is sticking our head in the sand. There's too many efficiencies, not just in the financial side of it, but on the medical side of it. I say to people all the time, don't be threatened by AI. I mean, what if you've got a patient and you're able to tell them that there's a million other people just like them that this solution worked for? That's what AI does for us. It's not about the scoring. It's about being able to provide a solution that is game changing for our patients. So technology is going to keep getting better and better and better. I mean, Moore's law is true. I mean, that things continue to double overnight in what we're capable of. So I think there's a part of this is embracing it and owning it as a technologist, but we're still going to do more inside the hospital. I mean, there's pediatrics that need care. There's comorbid patients that need care. But I think it's what we've been talking about this entire show is, are we owning that so that we can bring those patients in, get them tested, and recognizing that sleep disordered breathing is a confounding factor to their disease states. And they're not going to get better as long as they have untreated OSA. So we've got to step in there and fight for the patient. We certainly see how medication is going to affect how we treat patients. But, at the end of the day, one of the things we're great at as Americans is we're getting bigger and bigger every day. BMIs are crazy. So these solutions that are good for mild to moderate OSA are not going to solve the problem for the severe patient. And that's going to continue to be a problem. So, the idea that technology and medicine are going to displace techs is simply untrue. It's a sky's falling mentality. I mean, like I said before, 90% are undiagnosed and untreated. That means there's a lot of people out there that still haven't had treatment. But, I could go on forever about what I think this industry is going to do, but I think what we have is an opportunity to step in and create our own future, and we can control our own destiny. It's up to us. I mean, the three of us have done that with our lives, and the people we've had on our show, that's their thing. They owned their destiny, made a difference, and now they look like heroes. So I think the future for sleep technology and sleep medicine is extremely bright. I'm very hopeful about it. I'm very bullish. I think we've got great things to come, and I'm excited for what we're going to be able to talk about on this show and experience as professionals.
I'm glad I've let you go first, Emerson, because I was going to take a different approach. I actually want payers to get more involved in this. And what I mean is, payers and then also clinical research that can stand the test of governmental examination. And what I mean is, if you look back a couple of years ago with the AHRQ report that came out that talked about treatment of sleep apnea, and then the survey that came out last year that talked about, should we screen patients for sleep apnea? The results were, in one survey, it's, that the studies weren't done consistently enough from a clinical perspective to be able to put together a comprehensive approach to treating patients. The other one said, essentially, when it was all said and done, use your clinical judgment in how and when you screen patients for sleep apnea. So it was, that was inconclusive too. So I feel like we need, great clinical research that shows that a patient who is treated for their sleep issue is a lower cost of care to the system overall, and that ultimately they're longer, healthier, people once they've been treated. So that's the other hope that I have for the future of where sleep goes. But all the things that Emerson just mentioned are things that play into all of this too, because if we can use that sort of precision medicine approach to a patient, then we pick the right pathway for the patient, that based on their history, their socioeconomic situation, all of those things, in order to find the right treatment for that patient that they're going to use. And instead of trying to put everybody into the exact same clinical model, because it just doesn't work for everyone. So I'm also excited about the future. I think there's nothing but opportunity. And you mentioned that there's 1,000 jobs posted, Emerson. I know that there's companies that have given up trying to even have a job posting for a position because they couldn't fill those roles. So there is still the need for sleep techs. There will be a need for sleep techs, and if we can place ourselves in a different part of the patient care pathway, I think that it will help us in the long term even become a part of managing patients who who are very sick, who will benefit the most from the work that we do. Sorry, Jerry.
Hey, there's no need to apologize. That's what we wanted to hear, is your thoughts, and thank you so much for that. Yeah, I will say, a while back when I used to work for a diabetes company, and I thought it was interesting being a sleep technologist, having worked on that side, and I worked a lot with the payers. And it was so interesting for me to see how much emphasis these payers made on these conditions that they considered chronic, which was diabetes and hypertension. I'm just talking about those two right now because that's what we dealt with in the company, but there was no conversation about sleep, and I would definitely love to see that. And to your point, Emerson, about leveraging the technology that's available today in order to improve what we do, all these pieces coming together definitely will make a better future for all of us. But we are way over time, and I just want to say thank you, gentlemen, for your contribution today. It was really good. I enjoyed listening to you both, and I think it was a fun conversation. It's something different that we haven't done in a long time. And I want to thank everybody out there once again. Happy Sleep Tech Appreciation Week, and we thank you so much for being part of our lives. We do this for you, and we just can't thank you enough for that. We want to thank our sponsors as well for being part of this and supporting all the sleep technologists out there. Don't forget to like, subscribe, hit the star ratings, put your comments in. All those things help. Most importantly, do not forget to share this. Hey, give this as a gift to other sleep technologists out there during this week. With that being said, thank you all very much, and see you next time. A brief message from our sponsor, Medbridge Healthcare. For job opportunities with Medbridge Healthcare, please visit medbridgehealthcare.com/careers. Once again, that's medbridgehealthcare.com/careers.
Sleep Tech Talk is sponsored by React Health. React Health, headquartered in Sarasota, Florida, is a sleep and respiratory device manufacturer. By manufacturing our comprehensive range of products spanning from sleep to ventilation and oxygen solutions, we have curated our portfolio to offer unwavering support to physicians and DMEs across the continuum of patient care. Within our LunaPAP device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our LunaPAP device line while accommodating diverse patient requirements. Adding value for our patients and partners, our ventilatory solutions seamlessly support a patient's journey from the hospital to home. Rounding out our robust respiratory portfolio is our spectrum of oxygen support, including both stationary and portable oxygen concentrators, along with a selection of essential accessories.